Hello, good evening friends. Hope all of you are fine during unlock period. I was busy with my patient in my outdoor and also personal chamber and as well as an online consulting. We have started the new venture on online consulting. So I am very extremely sorry. Today we will discuss on the very common suffering the people are suffering from IBS. What is IBS? In short form is called IBS, irritable bowel syndrome. A bowel के अंदर there are so many problems are coming. In a common stage it is told IBS. The many of us people suffering from this type of common problem, that is bowel syndrome or IBS. This is called the problem in the bowel. You know, if you face the problem in the bowel, or the whole the day and our whole the work is became very much irritable. When our bowel is irritable, our whole the things, whole the system is irritable. The people who suffering from IBS, they face lots of problems. Especially, they are sometimes in case of IBS, there is a camping pain in the abdomen. Pain may not be there, but when he taking something, he feel irritable, huge, and the bowels is not clear. He or she may face dysentery, constipation, and diarrhea. All the bowel system is disordered. All the bowel problem is disordered. Actually, when the bowel is disordered, everything the हमारा सब कुछ problem हो जाते हैं. इसलिए तो पहले वो bowel syndrome का कैसे ये होते हैं. There are so many cause unknown or unknown जो हम बता सकते. The tension, stress. We are facing lots of stress in our daily life. We are always facing so many stress. When are getting the stress problem, our mental is mentally we are disturbed, and all the things are become disturbing of the bowels. This is the main one of the main cause of the bowel syndrome. There is another cause is the food habit. Where our food habit is very bad. Nowadays, we are taking so many junk foods. Another problem is coming from our lifestyle and sedentary lifestyle and food habit that causes of the irritable bowel syndrome. And sometimes I got the patient who have the family history, there is a IBS. Then how we can treat, how we can get out, not only treat, get out from the IBS or irritable bowel syndrome. How? First of all, हमने बताया अभी कि IBS के जो कारण है ना, वो अगर एनालिसिस करे तो हम लोग रादर आप लोग भी खुद IBS के ट्रीटमेंट और IBS से you can get away from the IBS if you are serious about your lifestyle. The change of your lifestyle is the main thing to treat, to get away from the IBS. So what is the thing? We have to get away from the stress and strain. How? The stress and strain is a common thing. It will coming in our life, in the daily life. You have another stress, I have another stress, some people have another stress. We have to get away from the stress and strain cautiously. With taking the decision, we have to get away from the stress and stress. How? Actually, what I do, and I suggest everybody, do pranayam. यू नो प्राणायाम, प्राणायाम का है सुबह ये हमारा जो माइंड है ना, अब जो माइंड है ये माइंड को हमको कंट्रोल करना पड़ेगा. फर्स्ट ऑफ ऑल वी हैव टू कंट्रोल आवर माइंड. माइंड इज एवरीथिंग. वी हैव टू कंट्रोल आवर माइंड. हाउ? इफ वी अलाउ द माइंड टू कंट्रोल बाय अदर्स, then mind will be controlled by the others. We have to control our mind ourselves. Second thing, you have to do exercise. You have to do, I do every day, you have to do exercise every day. Exercise gives you the alert energy, and exercise can remove so many problems. There are so many, there are one very good exercise for the abdomen. It will help to clear your abdomen, your gas formation and other formation. That is called Kapalbhati. Now, how the medicine? This is the main thing. You must, second thing, one, do exercise. Second, control your food habit. Low calorie food. नो तेल वेल वगैरह ज़्यादा, नो मिर्ची, नो तेल, स्पाइसी, नो जंक फूड, डोंट टेक. एक्सरसाइज, change in food habit, and sufficient quantity of water. These are the main three things you have to, if you do, your IBS problem with most of the cases of the go. Medicine is the secondary part to help you. Medicine is a secondary part to help you remove the IBS from your system in secondary way. In homeopathic treatment, there are so many medicine in IBS. You know, I told in the different views, we are treating the patient, not the disease. There are so many medicines in homeopathically we can use in IBS. One of the important medicine is the Nux vomica. Especially Nux vomica patient is lean and thin, irritable, easily excited, and he or she takes spicy foods. Nux vomica patient, there is a history of late night sleeping, and there is a history of the acidity. There is a soreness of muscle will be there in Nux vomica patient. Another medicine is podophyllum. In podophyllum is good medicine for the IBS. In podophyllum there is a especially diarrhea with a bad smell. Diarrhea with this bad smell. There is a gargling in the abdomen. These are characteristics of podophyllum. Sulfur, very good medicine for the IBS. In case of sulfur, this is IBS. You have to, when we are trying to treat the IBS, first of all we try to remove the symptoms when it is acute. Then we have to go for chronic treatment. Without chronic treatment, IBS cannot be cured. In case some medicine are there as acute or subacute, and then we go for chronic medicine. Sulfur is a chronic medicine. Sulfur patient actually they want to eat meat, sweet. They don't like milk, and patient is cannot stand anywhere. Sulfur patient's diarrhea, he wakes up in the morning with the urging to go to the stool, and sulfur patient is a hot patient, and there may be history of suppression of skin disease. This is the case of, in case of sulfur. Argentum nitricum. Argentum nitricum is another medicine. Argentum nitricum is another medicine. The gargling sound prominent in the abdomen. Asafoetida is a very good medicine. In case of the symptom is feeling of constriction in the digestive tract. The people, something is tight, something is there tight, constriction in the digestive tract. वो बताते हैं जैसे वहाँ पे थोड़ा टाइट हो रहा है, ऐसा हो रहा है डॉक्टर साहब, ऐसा मैं फिक्स हो और कभी कभी बोलते हैं ये गला में थोड़ा बबल फील is there, that some bubble is constricted in my throat. That is a asafoetida. Colocynth, there is a severe pain in the abdomen. in case of diarrhea, dysentery or the things, the colocynth is characterized severe pain in the abdomen, and colocynth, when the colocynth pain is coming, the patient want to doubling, moving forward. That is the characteristic colocynth. Lycopodium is very good medicine for IBS. Is a chronic medicine. The lycopodium patient is a chronic digestive problem. The formation of gas. Actually, this in lycopodium patient, gas is coming in the specific time 4 to 8 p.m. Specific time, on that time all the symptoms are aggravating. Lycopodium patient wants sweets, wants warm food. This is a lycopodium patient. Another good medicine, the Maxol. Maxol, there is a pain during the dysentery or diarrhea, there is a pain in the abdomen, not like a colocynth, but there is a pain, and the mucus is coming in the stool, that is a Maxol. Aloe-Socotina. Aloe-Socotina is another good medicine for the IBS. In case of aloe, there is when the passes the stool with the great sound, small quantity stool coming with the great sound. Flatus is coming with when the aloe is in case of aloe patient. These are the some of the medicine. Before that, there may be other medicine according to the sign or symptoms of the patient. The line of treatment will be one. If I summarize the total things, that one thing, you have to concentrate your mind through pranayam, you have to do exercise and abdominal exercise, Anulom and Kapal, especially Kapalbhati. Third, check your food habit, low calorie diet, no spicy food and other food with oily foods, no fast food. Fourth, sufficient quantity of water, and fifth one, medicine with chronic treatment. This is for today, and we will come in the next for another topic, and I will announce in the Facebook, FB. Hope it will enjoy things. If you have any query, you call us through our WhatsApp number and Facebook number. Thank you.